Alzheimer's. It is a common type of dementia and is a neurological disease that destroys a person's motor skills to perform daily tasks and impairs their memory. Alzheimer's, an incurable disease, is the most common type of dementia. Symptoms of Alzheimer's disease include difficulty remembering newly learned information, memory loss, behavioral disorders, and inability to perform basic tasks. Alzheimer's is the most common type of dementia, which impairs memory as a result of the death of brain cells and leaves the person unable to perform daily tasks. Alzheimer's, defined as a neurological disease, impairs a person's ability to think and destroys their motor skills in a way that seriously affects their daily tasks and simple tasks. Alzheimer's is also a disease whose symptoms gradually change and increase over the years, depending on age. Alzheimer's, which causes the brain to shrink and eventually to the death of brain cells in the advanced stages of the disease, negatively affects other organs and renders the person's body dysfunctional due to the death of brain cells towards the end of the disease. Among the early symptoms of the disease, the person begins to forget recent events, newly learned information, and conversations. Over time, a progression progresses to serious memory problems and loss of ability to perform daily tasks. Alzheimer's, for which there is no treatment option, can be diagnosed slower if the disease is diagnosed early. What are the symptoms of Alzheimer? The most common symptoms of Alzheimer's disease are difficulty in remembering newly learned information and memory loss. The symptoms of Alzheimer's disease are as follows. Alzheimer's symptoms in the early stages. Difficulty remembering newly learned information. Forgetting recent events, places, and names. Difficulty performing routine daily tasks. Having trouble finding the right words. Experiencing planning and organizational disorder. Weakness in decision-making and judgment. Being in an anxious mood, decreased problem-solving ability. Extended completion time of routine tasks. Symptoms of Alzheimer's in the middle stage, becoming in need of care and assistance, increased memory loss and confusion. Gradually losing track of season, year, week, or day. Difficulty recognizing family members or friends. Constant repetition of thoughts and events that cross your mind. Inability to do simple math calculations. Needing help, especially with personal care, developing unfounded feelings of doubt, becoming depressed as the disease progresses, experiencing sleep disorders. Severe Alzheimer's symptoms, also called end-stage Alzheimer's death symptoms, totally lost memory, complete forgetting of family and close circle, inability to perform basic tasks such as feeding, sitting, and walking without assistance, urinary incontinence, difficulty eating and weight loss, loss of ability to communicate, immunity decreases, especially against diseases such as infections. In general, the symptoms of Alzheimer's can be listed in stages, the most common of which are that the person needs help with his daily needs after experiencing memory loss, not knowing his immediate environment, and having difficulty communicating. In Alzheimer's disease, which occurs in initial, moderate, and severe stages, people stay in nursing homes, especially in the last stage, which is severe. In the final stage, along with serious loss of function in the brain, dehydration, malnutrition, and infections may occur. These complications can lead Alzheimer's patients to death. What causes Alzheimer? Alzheimer's disease, whose exact cause is unknown, is generally thought to occur as a result of abnormal protein accumulation, amyloid and tau protein, in the brain, resulting in damage to brain functions and death. Advanced age. Especially those aged 65 and over are among the highest risk groups of Alzheimer's disease. As we get older, brain functions slow down, and the disease has the opportunity to manifest itself more easily.